A new study estimates that the annual cost of sexual abuse of children in the U.S. exceeds $9 billion. Source May 21, 2018. Johns Hopkins Bloomberg School of Public Health Summary. The new study concludes that the annual economic impact of sexual abuse of children in the U.S. is significant and costly by 2015. The total economic burden will be about $9.3 billion and will include health care, child welfare, special education, violence and crime, and suicide. A new study conducted by the Johns Hopkins Bloomberg School of Public Health shows that the annual economic impact of sexual abuse of children in the United States is significant and costly by 2015. The total economic burden will be approximately $9.3 billion. A study published in the May 2018 issue of Child Abuse and Neglect used data from the National Child Abuse and Neglect Data System to provide a complete count of all child sexual abuse cases reported to U.S. child welfare agencies. In addition to the estimated annual costs until 2015, the researchers calculated the average cost of living for the victim based on specific categories, such as health, child welfare, etc. Most people are aware of the enormous mental and physical health of child victims of sexual abuse, but this knowledge is not enough to encourage serious investment in primary prevention, says the study's author, Elizabeth J. Among the limitations of this study is the limited availability of high-quality data on the economic impact of non-fatal sexual abuse on child victims. Finally, the overall economic burden of sexual abuse of children during their lifetime is likely to be underestimated because researchers rely on reported cases and it is widely recognized that these cases are underestimated. Annual losses from sexual abuse of children in the U.S. exceed $9 billion. According to a new study, Science Daily, a recent assessment of the economic burden of child sexual abuse in the U.S. is a crucial step that highlights the need for increased prevention, including increased federal funding for research on the prevention of child sexual abuse. The cost of a lifetime for men who have survived child sexual abuse is probably lower, probably because the economic impact of sexual abuse of children is not yet sufficiently understood. Literno, Ph.D., Professor of Mental Health at the Bloomberg School and Director of the Moore Center for Prevention of Child Sexual Assault. By 2015, the majority of child sexual abuse victims were women 75, compared to 25 of men out of a total of 40,387 cases reported in the National Child Abuse and Neglect Data System. The higher costs to women and men victims of child sexual abuse, more than $1 million in estimated damages, are associated with rare cases of deadly sexual abuse of children. In the United States, child sexual abuse is the 12th most preventable risk factor for morbidity in the country, but few studies specifically address the economic burden of child sexual abuse. According to one new study, annual losses from sexual abuse of children in the United States exceed $9 billion.